Today, I'm going to show you 7 early warning signs that indicates that your liver may be filled with or is being filled with fat, that most people tend to ignore them because they don't really know. They only tend to know them when it becomes too late. But the third point will surprise you, and I promise you, you are already doing the third point. I've got good news for you. So fatty liver is one of the diseases that can be reversed naturally. 2 months ago, we had a walk-in patient. He said, "Doctor, I'm constantly tired and I don't know why. I don't know where this tiredness is actually coming from." So he said, "Doctor, I sleep adequately. I sleep enough. I know I take some good night's sleep. But anytime I wake up, I feel so exhausted." Now, on a second glance at the laboratory test the person had done, we could tell that everything was normal on the labs, as in the blood panels. Everything was normal. But on a second thought, we decided to request for an ultrasound scan of the abdomen. And that was when something surprising happened and we were all marveled. The results shocked all of us. What we realized that his liver was already developing a fatty liver. The scary part, he had no idea something was even wrong with him. All he knew was he was just exhausted or feeling tired all the time. First of all, let's get to understand what the liver does. It's responsible for metabolic regulation, detoxification. It's supposed to produce bile, which is meant for digestion. And it also helps in protein synthesis and some nutrient storage. It means that if there is any issue to do with the liver, all these functions will be deteriorated. Now, let's get to know some of the warning signs. First is constant fatigue. This is what is happening. Imagine preparing your food for the week. You have to dish them into different forms of bowls to keep them in the fridge. What is happening here is because you have these bowls, you tend to fill them up to a particular level. But after filling these bowls up, you still have different remaining sauce left. You want to find a space to put the remaining sauce. There's no space in the fridge. There is nowhere to keep them. There are no left bowls. So you either have to keep it there or eat it. You are forced to eat the remaining sauce or discard it. This is exactly what is happening to your liver. You see, the liver have what we call hepatocytes. Hepatocytes are the cells of the liver. They are responsible for all the 5 things I mentioned about the metabolic regulation, the protein synthesis, the bile production, all those things. It is responsible for that. Now, the hepatocytes, because it has been filled with fat, okay, these fats are toxins, and the toxins are what we don't want in the liver or we don't want in the body. Because it has been filled with these toxins, let's put the toxins to be called fat. Now, the fats have caused exhaustion of the hepatocytes. There is no adequate space remaining to actually cause any production, which means that the liver is fatigued, it's tired, it doesn't know what to do, it is exhausted. It gets to that point where the liver can't actually do anything, and then it will replicate in the bodies, or it will testify, or it will be what the body is actually experiencing at that time. And this is going to lead to chronic fatigue and brain fog. Next is belly fat that won't go away. There is a close relationship between fatty liver and abdominal fat. Now, this fat is as a result of the fat storage disease that usually occurs in fatty liver. Now, this has a close relation with insulin. Because of this close relation, there is fat that accumulates around organs. Anywhere there is an organ, there tends to be fat that tends to accumulate around them. That brings me to the third and very important thing I want you to understand. There is some darkening around the neck region. Okay, from the neck, it always comes down. Sometimes it may appear in different areas. That is pigmentation of the skin. It is called acanthosis nigricans. This is a sign of insulin resistance, which is one of the major signs in fatty liver. Immediately, you tend to see pigmentations around the neck, around certain areas of the body. Bear in mind that there is something happening in the liver, and your body is just not accepting it. Now, the next one is elevated liver enzymes. Once upon a time, I went out with colleagues. We went to take some 1 or 2 things, had fun, and yeah. So I got to work the next day, and only to realize I wasn't feeling well. I felt so fatigued. I was so tired. I didn't know. I went to check my liver enzymes. Whatever prompted me to check my liver enzymes, I don't even know. But I checked and they were so high. But that is one of the things you will see. You find out, or you only tend to find out there is an issue with your liver after you might have done some liver enzyme or liver function test, which came out to see that there are different or deranged liver function values. So many people only discover that they have fatty liver only after they have done some liver function test. And so if you are not careful, or you are not someone who actually likes to have a routine checkup, then that becomes a very big problem. The fourth point is having mild pains. It may be there, it's not there, it's weaning off, it tends to come and go. That kind of pain, usually in the right upper quadrant, right here. When you constantly feel pain over there, it may be mild though. Sometimes it may get severe, or it becomes quite serious, and then you have to go to the hospital for some checks and all of that. Now, most people, that is the classical sign they tend to feel. Majority of the time, it's because there is fat accumulated in the liver, and so the liver has to expand, it has to give way. We call it the hepatomegaly or hepatomegaly. Now, in this phase, there is the liver actually hitting or touching on the peritoneum of the abdomen. That cause to bring out that referred pain, the pain that you constantly experience. The next one is high cholesterol and triglycerides. Let me keep quiet here, because I might be saying someone's very important issue. Do you know that fatty liver usually travels with metabolic syndromes? Metabolic syndrome had to do with majority of our endocrine organs. Okay, you see that it's moving in line with the insulin. I had already mentioned insulin resistance in one of the factors. So fatty liver actually has to do with storage of cholesterol and triglycerides. In further videos, I'll be bringing you much more enlightenment in these aspects. So sometimes you just go and do a lipid profile, and they'll tell you triglycerides are high, cholesterol is high, and they will tend to even check your HDL and LDL, and both will have some forms of variations. Another warning sign that you should take very serious or cautiously is pre-diabetic or type 2 diabetes. If you have any of these, you have to be very careful, because these conditions dramatically increases the risk of accumulating fat in the body. I've got good news for you. So fatty liver is one of the diseases that can be reversed naturally. So in my subsequent video, or in the next video, I'm going to show you some nutrients or some dietary mechanism or natural therapies that you can use in order to reverse your fatty liver. In order to catch on to this video, kindly subscribe, like, share, and put in the comment section which of these early warning signs do you see in yourself, or have you picked up in anyone near you.